Welcome to another episode of Health is Wealth, only on Business Access TV. I am Whitney McCoy. Now, Mental Health Awareness Day is October 10, and in honor of that, we're sitting here today with Ms. Djavila Ho, President of the Jamaica Psychological Society and clinical psychologist, Ms. Daniella Sykes. They're going to tell us all about their Out Stigma SOS on the Couch campaign. Hi, thanks for coming.
Thank you for having us.
Thank you for having us.
All right, so tell me what exactly is SOS?
So SOS stands for Stamp Out Stigma. It's a mental health awareness campaign and anti-stigma campaign. We are looking to educate people, especially younger people, about mental health, increasing mental health literacy, empower them to talk about mental health. And we want to do it in a way that's fun, accessible. So we're having celebrities and influencers sit on a couch and talk to us about their experiences in mental health, because the best way to decrease stigma is to talk about it. And seeing celebrities and influencers who are, known to be successful, sharing that, they also have mental health challenges, they also have struggles, is a good way we think we can connect with young people on this topic.
All right, so this year's theme for Mental Health Awareness Day by the Mental Health Federation is Workplace Mental Health. How does the SOS campaign focus on that?
Well, a lot of our guests are creatives, so they may be videographers, filmographers, musicians, actors, etc. So their workplace is a little bit different from maybe an office, but they speak about how they handle stress. Parts of their careers are being in their workplaces, being in the public image, and a lot of people having access to knowledge about them and how they handle that and how they handle the mental health challenges that can come with that. So that's sort of how we talk about it on the series.
And what are some of the common misconceptions with mental health?
Well, I think one of the first ones that comes to mind anyway is that mental health equals mental illness. And that's not correct, right? We all have mental health, right? If you think about your physical health, some of us are, in good, physical health, we're doing well. And there are people who have illnesses, right? In the same way, mental health is something that we all have and that we all need to take care of. There are people who are doing well, emotionally and socially. And then there are persons who are having some significant struggles and maybe more on the side of illness. And so I think that, there's that misconception that if you have mental health, you have mental illness. And that's not the case. We all actually have mental health.
And how can someone, per se, reduce the stigma? How can we as a society reduce the stigma around mental health?
Well, I think what you're doing here today is a great example. We're talking about it, and I think with the SOS campaign as well, we are bringing more awareness to it, and so hopefully we are generating some discussion amongst persons as well, whether it's within the workplace, amongst their friends and their family, to really recognize again that it's not something that's so far-fetched, right? It's something that can impact everybody, and that there are ways that we can already begin to improve and maintain our mental well-being and hopefully prevent the onset of certain mental illnesses.
And another thing that we can do, which we're also trying to promote in this campaign, is just being very careful with our language. Language matters a lot. There are a lot of phrases like people saying, I'm so OCD, when that's not really what obsessive compulsive disorder is, or using phrases like madness, etc., to talk about mental illness that can make people, if you hear someone speaking like that and they're your loved one and you are having struggles and maybe you want to talk about it to that person, you hear that, you may shrink away and say, oh, maybe this is not a safe space to talk about that. So just being very careful about our language and how we speak about mental health.
All right, so what exactly is the ultimate goal of the SOS campaign? What do we hope to achieve from this?
Ultimately, what we hope to achieve is to leave everyone who watches it with more information about what is mental health, what is a mental illness, how is that different from having a mental health challenge, what are the different mental disorders that are out there that are prevalent, how can you seek help, when is it that you need to seek help, and just the general idea of all of us just being very empathetic and compassionate to each other, understanding that we're all going through struggles, and the best way for us to destigmatize talking about mental illness and mental health is for us to all just be compassionate to each other and talk about it a bit more.
All right, and so as previously mentioned, mental health in a society like that, what we're in is kind of taboo. Nobody likes to talk about it. Everybody's like, they shun away from it because they associate it with being mad or crazy. What advice would you say you'd give to someone whose mental health might be compromised and wants to seek help?
Well, I think it's important to recognize why people are sometimes hesitant to seek help. As you mentioned, it's a little taboo, so they don't necessarily feel comfortable sharing, or they're afraid that, if I share something with someone, they may think, as you said, that they're crazy. I think also some people have, unfortunately have had bad experiences in the past with sharing, and so that's part of why, they feel like they may not trust someone. And then also I think people don't know what to expect when they see a mental health provider. And so I think if someone recognizes that they are having some challenges and really wants to seek out help, one good way, I think, is to begin by, well, I'm gonna so self-promote here, but if they go on the Jampsych website, there are a list of practitioners, there's contact information, there's even the parish that they may be located in. You can call and find out a bit more about setting up appointments. There's also a resources page that lists a lot of public resources, including the hotlines that are available, as well as just general services to the public. And then in terms of what to expect, because I think that's part of the fear of going, what am I going to have to talk about? That first session is really a lot of just getting to know you, right? Because you do have to feel comfortable with the person that you're going to be sharing with, and finding out a bit more about why they are there and what the goals are for their healing journey. And the aim of the mental health practitioner is to support them and guide them, with the tools and skills that they have, and help them to meet those goals.
Awesome. So while there is mental health, there's also mental illness. We tend to shun people who are mentally incapacitated or whatever. What are some of the stigmas, or how can we reduce the stigma that surrounds mental illness?
Well, I think, Daniella had shared some earlier, and I do think, again, thinking about mental health as a spectrum of things, right? If we have a difficult time in our life where we're struggling to cope, that is a mental health concern or challenge, but it's not necessarily reached the level of a diagnosis or an illness. But also, I think it's important to recognize that mental illness is treatable. And so when you meet someone who may be struggling, if you are in a position to help them access care, then that's a great way to start, rather than shunning, right? People who have mental illness can be completely functional in society and add productively to our society. And I think it's important to remember that, right? Just because someone may be having a significant mental challenge at the moment doesn't mean that they cannot function. If they get the adequate help and care that they need, then they actually can, continue to live a healthy and productive life.
Yes. And then mental illness, it's not just the man that's walking on the street, the church clothes. It's not just him.
No.
What are some types of mental illness that we might not know that is mental illness, but it is categorized as such?
So there are several different types of mental illnesses or mental disorders. For example, we have anxiety disorders like generalized anxiety, specific phobias. We have obsessive compulsive disorder, which is when someone has obsessions and compulsions or compulsions. We also have depressive disorders like major depressive disorder, persistent depressive disorder, and we have personality disorders. There are eating disorders. So there are a range of mental health disorders.
Absolutely. Even, if you think about learning disorders or intellectual difficulties, those are also considered under the concept of mental illness or mental health challenges. So again, psychologists work with persons to help identify, and this may be through a psychological assessment, to help identify what some of the areas for improvement might need to be, specific learning strategies that may be more helpful. And this could be for children, but even for adults as well. And so again, those are just different ways of addressing mental health conditions. I think those are things that people don't necessarily think about. They may think about the extremes, like the depression and the schizophrenia, but again, it includes a lot of these other conditions that can be treated by psychologists and counselors.
And if someone is undiagnosed with mental illness, say in the workplace, my coworker, how do I know that this person needs help, or how can I identify without them being diagnosed that they might be having some mental health challenges?
Well, some telltale signs that a person may be struggling with a mental health challenge or a mental illness might be if well, if they express any suicidal ideation, any thoughts of death, of wanting to die, if we were to notice that they're abusing any drugs or alcohol, if it is that they're isolating themselves socially from their social circle. So I guess in the workplace, that could be if they're isolating themselves from all their co-workers, not really talking to anyone.
Well, I think some other things, in a general sense, I like to think of them in categories. So if you see any significant changes in, emotions, so maybe how they may express themselves, somebody who may have typically been very quiet and reserved, but now suddenly is lashing out a lot more. You're seeing that more frequently. If you see changes in just thinking style, so maybe some of the things that they might express, it might be, thoughts about harming themselves, or even just maybe more some unusual thought patterns, and you think, okay, well, that's not typical for that person. And then, of course, the behaviors. So maybe they're not taking care of their personal hygiene as they would typically, or they're not sleeping very well, or you notice that they're not eating as much. Those are things that you want to maybe try to check in on and see what's going on, and if possible, again, direct them to at least have, one conversation with a mental health practitioner to find out a little bit more what might be happening.
Awesome. And how can family and friends support someone with their mental health well-being?
Well, so I always go back to this, just remembering that we all have mental health. So one, it's not, us against them. I think listening and trying to understand what someone else is going through rather than listening and trying to judge and just kind of, prescribe all these things. I think it's important to just kind of hear what someone is going through. Sometimes that type of support is maybe enough, depending on what the circumstance is. I think also, again, trying to direct them to somebody that they may trust. It may not initially be a mental health provider. It may be a trusted family member, a friend, for people who may be religiously oriented, it could be somebody at their church or otherwise. And I think that kind of helps people to take the next step. I don't know if Daniella has other.
I think that was a great answer.
All right. And then we're in this technological age where everything is at our fingertips. What role does technology per se plays within the mental health society?
Well, with technology, I think there are lots of pros and then there are some cons, right? We know there's some benefits and some disadvantages. I think one of the biggest benefits is access, right? People can hear stories that, just like with the campaign. You wouldn't have known about the campaign if you didn't see it popping up, right? And so I think technology has allowed people to be able to access information about mental health in an easily digestible format. I think there are skills that people can learn even just from YouTube, skills that we maybe teach in our therapy sessions, but now they can access some of that information and begin to practice it on their own online. And so I think a lot of learning can take place through technology, and again, destigmatization, because they're hearing other people share their stories and their experiences. But then I think on the flip side, unfortunately, sometimes we have misinformation. So people sharing information that maybe they're not qualified to share about, or it's just incorrect. And it's important for people to be able to determine what is accurate information about mental health and what isn't. I think also there is, data that suggests that it's even social media. It does contribute sometimes to some of the mental health conditions that we're seeing popping up in, young people: depression, anxiety, loneliness. And so again, there's a thin line between the benefits and the cons. And I think it's important for people to try and, enhance the benefits and navigate some of the negative things, make sure that the person who's providing the information is a mental health practitioner, right? Someone who's trained and licensed to provide that kind of information, or at least provides a disclaimer to say that, okay, they're not a mental health provider, but this is their experience, but make sure that you check in with a provider. So something, along those lines, to be able to better manage and utilize technology to their advantage.
Okay. And then the Jamaican culture. When that's a big thing. How do you approach mental health within the Jamaican culture? Because they always say, like, once you have something that you're mad, is a mad person. How does one approach it from a cultural difference perspective?
Well, I think again, the campaign right here, we're using Jamaican people. Sometimes you'll see stories coming out of America and so forth, and it's not necessarily relatable. Okay, that's their problem. But here we have Jamaicans sharing their experiences, and it's a wide variety of people. I think that hopefully a lot of young people in particular can relate to. But in a general sense, as practitioners, we do have to recognize our cultural context, not just the history and how that has impacted some systems and experiences that people may have, but then even just within our culture, the little differences. I think a prime example is young people. There's a lot of slang nowadays that, I mean, God help us to try and figure out what some of it means. But if that's the way that young people are expressing themselves most comfortably when we meet them in a session, we also have to kind of be aware of, okay, well, what does that mean when they say that, right? So that we can relate to them a little bit better and allow them to comfortably express themselves rather than kind of stifle their type of expression. I think another way that we try to infuse culture is, adapting some of the very traditional treatment skills and strategies that we may use. It may not look like the textbook had outlined it because we know how our people are. Maybe it's with the storytelling or, infusing the arts, with certain things. And I think that's a primary way that we do try to infuse culture and make sure that it's more relevant to our population.
And what trends do you see regarding mental health when it comes to different age groups? So whether it's from the baby boomers all the way to Gen Z or Gen Alpha, what trends do you observe?
Well, for younger people, or I should say young children, there are trends towards, anxiety, depression, behavioral disorders. When it comes to young adults, there are a lot of concerns about transitions, so transitioning into adulthood, college years, etc. And in terms of the research, I was reading recently that there tends to be a larger gap between unmet needs and the amount of mental health issues that particular age group is having, younger people. And as we get older, older folks are also having challenges with isolation, loneliness.
Yeah, and I think it's important to remember at each of these life stages, there are different challenges that we're facing. So an older adult is dealing with, maybe they have children, but they also have aging parents, right? Or an older person is dealing with some of the health concerns that come up in older age, and so we'll still see depression and anxiety. It may look a little differently than, with a child, but we still see, especially depression and anxiety. Those two are pretty common across the lifespan. But that's where you sort of see some of the differences. Daniela also mentioned that transition age from, high school into early adulthood, and, the added responsibility and stresses that come with that identity. These are things that can impact how people are now thinking and perceiving themselves, and can also, influence how mental health conditions may manifest at that time.
And aside from Jampsych as well and some of these private institutions, what can you tell us about some of the public institutions that are in support of mental health? Say I wanted to seek help. What are some of these institutions?
Well, as I mentioned, Jampsych. So Jampsych is a professional body for psychologists and counselors, and so we do ensure that our membership, so those psychologists and counselors and psychology students, are always keeping up to date with information and are equipped to provide care. Those who are doing clinical or counseling psychology, but so those people are accessible to the public. They may be private institutions, but you can access them. But also the Ministry of Health and Wellness does provide psychological and psychiatric services. Again, on that resources page I mentioned on our website, it does identify like where some of the mental health clinics are regionally. And so that is accessible. There's Rise Life, which deals a lot more with persons who may have substance use disorders and or struggling with substance use anyway. Any other publicly available centers you can think of?
I mean, I mainly know of the mental health days at the different public health clinics and hospitals over Jamaica. So,
yeah,
that's also an option.
Yeah, I think that's a primary way to begin. If you're in the public system, especially, and you go to a clinic or something, you can ask to speak to the mental health provider there. Again, normally it's a psychologist or a psychiatrist, but some of these clinics have specific days. So if you check the website, you can see the specific day in your region.
And if someone needs to be committed, it will be at a public hospital?
Yes, it would be a public hospital. I think only the University Hospital, the West Indies, and I think possibly Cornwall, you have to can't verify that at the moment, still have a ward dedicated to psychiatric patients. Most other hospitals will still admit and provide treatment with a consultant psychiatrist, but they don't necessarily have a very specific ward allocated to that. The ideal here is that people can be treated as outpatients, and so kind of going back to the community mental health model, and so that really would be in very severe cases that somebody would need to be admitted to the hospital. Mm-hmm.
Right. So tell me about On the Couch. SOS On the Couch.
Mm-hmm.
You just walk me through what motivated you to start the campaign and how it's going so far.
So how this campaign came about is I was part of the Learning Leadership Institute, which is a program by the American Psychological Association's Office of International Affairs and the Global Psychology Alliance. Together they came up with this program where emerging leaders in psychology from different countries all over the world could get mentored by more established leaders in psychology from another psychological association from somewhere else in the world. And we were given a project to do, and one of the topics I could choose was creating a project looking at reducing barriers to accessing mental health care. So I looked into the research on accessing mental health care in Jamaica, and stigma was definitely a big barrier to accessing mental health care out here. So I came up with this idea of how can I, on a large scale, try and reduce stigma, because it's a difficult task that's on a large scale, and I thought a public health campaign would be beneficial, especially one where people can recognize the different persons talking about their mental health challenges, and I wanted it to be targeted towards young people. So that kind of inspired me, especially because I am a mental health care provider, so this is something that is important to me. When I see clients, it's important that on a personal and professional level that I want people to feel like they can come in and access that care. So that's how that started.
Awesome. And if someone is watching today and maybe wants to check you guys out, how can they find you?
So they can find us on Instagram at SOS Mental Health JM, as well as on TikTok. That's for our social media pages. We're also on YouTube. I believe it's also SOS Mental Health JM. I may be incorrect, but we can check that. And then in terms of finding Jampsych is also on Instagram. I believe it's at
Jampsych, that's JAMPSYCH_JM. And we also have a website, jampsych.com.
Okay, and how often are episodes released?
As often as we can.
And they're on YouTube?
They're on YouTube and on our Instagram.
Right.
All right. So, mental health in the workplace. We're here with Djavila Ho and Ms. Daniella Sykes. They're both from the Jamaica Psychological Society. Check out their SOS campaign. They're on Instagram and YouTube. I want to say thank you guys for coming in and sitting with us and enlightening our audience on all that has to do with mental health. All right?
Thank you.
Thank you for having us.
Yeah, no problem. All right, so stick around. Don't move more after the break.